A very good afternoon, respected judges, panelists, my dear friends and colleagues. The topic of my presentation is clinical outcomes and patient satisfaction following bilateral implantation of PanOptix toric IOL. My co-authors are consultants to Carl Zeiss Meditech. I have no financial disclosures to make. The study was, however, supported by a grant for the investigator-initiated trial funded by Alcon. In recent times, an array of multifocal intraocular lenses are available to aid in spectacle independence, turning cataract surgery into a potential cataract cum refractive surgery. Preoperative astigmatism of more than one diopters is seen in as much as 47% of the eyes, and various methods are employed to combat it, including toric IOLs. A residual astigmatism of more than one diopter can severely impact the vision, and in general, the goal when correcting astigmatism during cataract surgery should be a post-operative residual astigmatism of less than 0.5 diopters. The new PanOptix IOL features an innovative quadrifocal design with a central diffractive region of 4.5 mm, optimizing near and intermediate vision over 40 to 80 cm. The Enlightened technology enhances the energy light utilization at 3 mm aperture to 88%, which is 6% higher than traditional multifocals. In this, the extended intermediate focus is shifted to the distance point, technically making it a modified quadrifocal IOL. As compared to Restore, PanOptix has 15 diffractive rings with a near add of 3.25 diopters and an intermediate add of 2.17 diopters. The central diffractive region is of 4.5 mm to aid in good intermediate as well as near vision. So we undertook this clinical study to evaluate the clinical outcomes with this IOL and a real world evaluation. So 30 patients underwent bilateral implantation with this IOL. All IOLs were implanted were of standard range. All eyes were targeted at emetropia using the Barrett TK toric formula. Post-operative examinations at 6 months included uncorrected and corrected distance, intermediate and near visual acuities. A defocus curve testing was charted. Reading spares were evaluated with Salzburg reading desk, and subjective outcomes using IOLSAT quality of vision questionnaire were assessed. Post-operatively at 6 months, all patients had a binocular UDV of 20 by 20 and 30% patients had even 20 by 16. The spherical equivalent was within plus minus 0.13 for 82% of the patients. All eyes had a refractive cylinder less than 0.5 and 88% of the eyes had even lesser than 0.25 diopters. ETDRS charting was used for uncorrected and corrected near as well as intermediate acuities, and the results were quite good. Reading speeds assessed with Salzburg's reading desk at 40 cm was 166 words per minute, and at 66 cm it was 164 words per minute. The binocular corrected defocus curve charted showed good functional vision of 20 by 32 or better over 3 diopters range of defocus. IOL's quality of vision questionnaire was done, and the patients were asked about the vision in bright and dim lighting conditions up close, at arm's length as well as at far away distances, and revealed high patient satisfaction. In a comparative study, accuracy of PanOptix yielded better near visions than the EDOF Symphony. In a study assessing the outcomes of PanOptix IOL, 96.9% of the patients achieved spectacle independence and expressed a high degree of satisfaction. In another study comparing the visual quality and subjective outcomes between 3 trifocal and a bifocal IOL, PanOptix had better intermediate performance. Thus, to conclude, in our study, PanOptix toric IOL allowed complete visual restoration with excellent visual quality outcomes and patient satisfaction, and appeared to have good rotational stability as well. No eye developed PCO or glistening by the end of 6 months, affecting the results. Thank you so much for your kind attention.
Thank you.
Thank you for the excellent presentation. What was the night vision in this patient, since the lens is yellow in color, which filters the violet and blue color? Have you noticed any decreased vision, or they require more light?
No, sir, as of now we have not. We utilize the IOL quality of SAT vision questionnaire. So basically the same questionnaire was also given to patients at 15 days, and then we compared it at 6 months, which was the endpoint of our study. So the question looks at vision and patient's experience at all ranges of vision, from bright light to dim light, at all distances, near, intermediate as well as. So as of now we have not found out anything on.
Why did you do a comparative study? Why?
Ma'am, this
observation. No?
yeah. So basically this study we started in February 2020. Then following COVID, a lot of this is a prospective study which is still ongoing.
I know, but it should have been comparative.
Yeah,
no?
so in our
With
next
what?
phase,
Because
we are
there
comparing
so many
it-
lenses claiming so many things.
Yes, ma'am. In our next phase, we are comparing it with
Should
3
be
different
double-blind.
lenses. So there are 3 different prospective studies going on, and this still remains an ongoing study.
Okay, so it's a somewhat incomplete study rather. Sample size? How did you
Sample size,
calculate?
as of now, we have
Because-
implanted in this particular study 30
No,
patients.
what basis did you take that sample size? How did you calculate?
So we initially
just
had a
take
sample size of
arbitrary
33 patients. For minimum significance, we have evaluated 30 because our enrollment was severely affected following COVID, and this was a company-funded
We're only asking you
investigative
what is the
trial.
sample size which you would have.
Yes, sir.
Shall we call the next patient now?
Yeah,
Thank
they are
you.
calling about the power of the study, but it's okay. You can
Yeah.
just do it. What he says is right. Thank you.